Well, hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be the host for today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you for your time. On today's episode, if you are a parent, I want you to pay close attention, turn your speakers up because what we're about to discuss I think is going to have a major impact on you, and it's this problem of ear infections. Now, before we get started, I have some little medical research here that I want to share because some of this is amazing to me.
Mm-hmm.
And it says, and this is from the American Academy of Pediatrics, it says that there were over 30 million visits to doctor offices and 10 million prescriptions of antibiotics each year for ear infections in children.
Unbelievable.
I mean, that to me was amazing. And then there was a study that showed there were 3,600 children, and these children did not take antibiotics. Okay? And they had a higher rate of recovery than those who did take antibiotics. And despite these clear guidelines, many pediatricians continue to prescribe unnecessary antibiotics.
This was on the news. I remember hearing this, and they're saying that if you have an ear infection, it's kind of self-limiting, and you don't need antibiotics. So the antibiotic, believe it or not, Jerry, is like dropping a nuclear bomb on the kid. So it's overkill. So you drop the antibiotic, what it does, it kills out your healthy bacteria, and they get a yeast infection. So then they don't even know they have a yeast infection. They continue giving more antibiotics, and that actually makes them worse.
Yeah, because I know the antibiotics that they're giving these kids now, they're such condensed down over like a 3 to 5 day period where they're just really...
And it's not working. It's not working. Then you know what happens? The research shows these kids are getting tubes in the ear.
Right.
And a lot of times that doesn't work, and you need more tubes, or they get scar tissue.
Yeah.
It's just, to me, it's insanity.
Yeah, being a parent, I can relate to this. I mean, luckily my kids had, an occasional earache, but not like some kids. I mean, none of my kids had tubes or anything like that.
Right.
But, I know people who it's just a continual thing. The earache will go away for a while. Oh, they're back with with an earache again.
People don't realize, Jerry, see, the nerves in your neck control the muscles in your ears. Your ears have muscles, and these muscles actually release or cause a popping sound like you're in an airplane and your ear releases. That's the key to this. See, when these kids pop their ear, we can actually adjust the ear, by the way. So when you treat the muscles or the nerve that goes to the muscle and the ear is able to pop, what happens, the good news, Jerry, is the patient, the baby, can drain. And when they drain, what happens is the infection is released too. So that's where the infection gets trapped where the fluid is. So the fluid can't be released because the ear can't pop. Why? Because there's a misalignment of the vertebrae in the neck that controls the muscle that controls the popping. So in addition to that, we can actually adjust the ear.
Now, I know one of our prior videos that we did, we talked about chiropractic in young kids. Right? And that really there's no, chiropractic care can start right away.
Yes.
There's no right. It can be an immediate thing. So, if you're watching this show and you've got a child that's maybe continually having these problems, they owe it to themselves to say, listen, let's exhaust all options.
Because it's a conservative approach. We're not giving you an antibiotic. We're not causing side effects, a yeast infection. We're not, God forbid, going to give you tubes in your ear, surgery, scar tissue. So it's like you do the conservative approach first. If that works 9 out of 10, you don't need the radical.
Yeah. That's, I know there's a lot of parents right now that are dealing with this, and it's a very stressful situation. Because when your kids are continuing getting these earaches, I know what that's like because I've been there. But, I think it's just something that, one, as I was preparing for this show today, I'm thinking, I know there's not a lot of people out there that understand that chiropractic connection between an ear infection, and how that works and how it working together, they could really give great results.
Because people's not educating them, their medical doctor's not telling them. I guess their schools aren't telling them. Their family and friends, they don't know about it.
Yeah.
So it's like the blind leading the blind. So therefore, with these videos, hopefully people are getting educated and getting an option and make some intelligent choices.
Yeah. Because I know the office visits normally for an ear infection are very short and sweet. You come in, they look in your ear, oh, it's infected. They get out the prescription pad, here you go. And, as we discuss on all of our shows, the main thing with chiropractic care is that you guys really strive to get down to that root cause. Something's causing these chronic earaches. And it's not a deficiency of antibiotics in our body.
Understanding, Jerry, the healthiest kids know the chiropractic kids. The kids who get adjusted, the kids that, believe it or not, don't need immunization shots because they're healthy. See, it relates back to the theory that if you're healthy, you don't get sick. See, germs cannot attack a healthy person. Just like in your kitchen, if you have garbage, you're going to get rats. So if there's no garbage in your kitchen, you're not going to get rats. Why? Because the rats and the germs are the scavengers.
Yeah, I think it's, people have, yeah, I think it's just time that we all, and I've, over the months that we've been doing this, I've become much more educated on
Right.
the impact of all, of really how our spinal cord and that efficiency of our body impacts everything.
It's a holistic approach.
Yeah, these problems that we have are really kind of like the outskirts of what the problem actually is. You've got those nerve problems, and until that's treated, and kind of got back to where it's functioning at 100%, you're going to continue to have these problems. This cycle's going to continue.
People don't realize that your structure affects your function, that your brain and your spinal cord controls every cell and organ and muscle in your body. I'll just give you this, Jerry. Your immune system is actually hardwired to your nervous system. So when you help the nervous system, Jerry, guess what you're helping? You're raising your immune system. I'm going to give you the statistics. Anywhere from 200 to 400%. So when you raise your immune system, you're a stronger host. You're going to be able to resist whatever's going around. So Susie and Janie, they're sick, but you're going to be healthy because they can't give you anything because your immune system can handle the environment. It's stronger than the germ.
Yeah, because we all have those friends that are constantly sick. I mean, if there's a germ in the room, they get it, and it's,
There's a reason for
done.
that.
Right.
Their immune system's down. So we say, get the patient in here, get their immune system, get their nervous system, their immune system, and then the patient's a stronger host. They're not going to get sick.
Yeah. Yeah, I mean, I can't stress enough to everybody watching these videos, whether it's you're dealing with ear infections or just general health problems, the importance of understanding your spine, the function of your body, making sure that when that alignment is good and that is functioning well, a lot of these other problems don't happen. So you owe it to yourself to look at those problems. I mean, look at implementing chiropractic care as another tool in that toolbox. Because when you're lacking this tool, you're really lacking the main tool. I mean, this ought to be the main tool in your toolbox.
We're not a hammer. We don't see as a nail. In our toolbox, we got a screwdriver, a Phillips, a wrench, a saw, and a blowtorch. So it's many causes, many cures, okay? So you live your life through your nervous system, Jerry, okay? That your nervous system is the master system. So when you get to the master system, and when you were formed in your mother's womb, the first thing that formed was called the notochord, which is your brain and your spinal cord. And God did that for a reason, because he knows that it controls everything. So when you get that aligned, you keep your spine aligned so you're feeling fine, and you get your brain and spinal cord working at 100%, 9 times out of 10, you're not going to get sick.
Yeah. And the interesting thing when you talk about normally when you see people coming in here for these various conditions, they're getting relief on a relatively short period of time.
That's the thing about chiropractic care. It's scary, Jerry. You know why it's scary? Because it works too good.
Yeah. It is amazing, and that's why one of the things I know you just did some upgrades on your website.
Yeah.
If you visit AskDrGoldberg.com, you're going to be able to schedule your appointments actually online and communicate that way, or you can pick up the phone and call the office. But more importantly, you can check out the reviews that people are writing about the care that's going on here. I mean, I think there's over 30 of them right now in a short period of time, and just kind of see what other people are saying, and really how some of the problems that they came for, they didn't even realize chiropractic care could help.
That's right.
And now they're walking out these doors saying, chiropractic care is the best thing. Should have been involved with it a long time ago. And that's what all we ask is that you give chiropractic care a shot. Right? I mean, you've tried everything else. Give chiropractic a shot, and I think you'll be amazed at how it can impact the problem that you're presently having, and can really impact your life in general. So, with that, we really appreciate you watching our show today. We hope you kind of find our banter to be educational and informative. We look forward to just month in and month out talking about some of these interesting concepts, and just helping you get that education that you need to make a good, wise, informed decision about your health care. And that's what this show's all about, is making sure you're making proper decisions and dealing and making your body function at 100% and living that long, healthy life. So thank you very much for watching. We look forward to seeing you on future episodes. Check back often. We got a lot of great things that we're adding on a continual basis. And we really look forward to just being a major player and team member on your healthcare team. So have a great day, and thank you for watching.